Welcome to Good Neighbors, and we are going to find out some information on today's program that might be a reminder. It might be startling, and as well as it might be enlightening. I know it will be enlightening, and I thank you, of course, for tuning in to Good Neighbors on this station. And on today's program is a special program, as I call all of the programs special, and of course, special guest, extra special guest on today, individual that I've met, and we've grown to know each other, not just naturally, but also spiritually, and that's a blessing when you can get to know someone overall, I say it like that. And I thank God for this gentleman who's going to give us information about an organization whom some people, when they hear the word, they become afraid, and they think that all is lost, all is gone. But we're going to give a new light to the organization. There are some things that are, of course, are evident, but also there's some things that you need to know, we all need to know, to comfort us as well as to be a strength to us so that we can help others as well. And I'm referring to Hospice of Wichita Falls, and I thank God for having on today's program Chaplain David Barnes, and welcome to the program, sir.
Thanks, Samantha. It's good to see you again.
You're welcome. Good to see you as well. And I've seen you in other capacities, and you've transitioned in life with some things, but this place right here that God has you, Hospice of Wichita Falls, is a place of a lot of different things. And I know you've seen a lot of different people, but first of all, we want to know a little bit about you.
Thanks.
You're welcome.
Well, I was in the pastorate for a number of years here locally, and we went through some transition and some changes of life, and I began to kind of consider what I was going to do next, and literally this opportunity kind of fell in my lap. I was going for something else, and God said, no, we're going to do this, and never ever envisioned that I would be a chaplain for a hospice, because I had some of those misconceptions that you're referring to. You know, I thought hospice was a place of death and dying, and a place where you went when you'd given up and you had no hope. And I was so very wrong, because I found that it's just the opposite is true. Hospice is a place of hope. It's a place of life. And hospice is not a place.
Okay.
Because a lot of times we think hospice is that little place, Hospice of Wichita Falls is that little place over on Johnson Road that has a 12-bed inpatient unit. And it's so much more than that, because we have over 200 plus patients on services with us.
Wow, and people don't see that aspect of it. And I want to go back for a minute. We're going to get more into the meat of the hospice, but I want to also bring out, being that this is a good neighbor, so we're going to do some good things to help some people out.
You bet.
Well, you first said you were a pastor, and now you're not pastoring. Oh my God! And I just thank you for being real, because a lot of people are like, well, I wouldn't admit that, and I was this, and now, no, but that to me is saying that you obey God.
Yeah.
Because some people, I'm gonna be real, are pastoring, and they really should be just, an assistant minister on the staff, and some people are assistants, and they should be pastoring. Some people in the choir, we know they need to be on the usher board, and some people on the usher board need to just be in the pew praying for, everybody else. But, I'm digressing a little bit, but I just want to take that time to thank you for bringing that out, because that will affect someone else's life, not necessarily in the church, but also in life general, to know I need to obey, even if it is time, I need to obey, and it's time for someone to go to hospice or receive the services. Now, hospice is located on Johnson Road, and give someone the vicinity, the area.
Well, we're actually right next door to Ryder High School.
Okay.
And the inpatient center's around the back, and that's where most people think of when they think of hospice, but there's a big building there that I would drive by when I was here as a pastor. I would drive by and I would see that big building, and it never dawned on me that there was just more going on there than that small inpatient center that I, like you, had been into several times to visit patients that were sick and that were dying. And I got my eyes opened that hospice is not a place, but it's a concept of care. So it can be done wherever the patient calls home.
Great.
Whether that's in their own house, or whether that is in a nursing facility or a skilled nursing facility or an assisted living facility.
So it's not just, and this is something extra new for me, it's not just at the hospice building, the facility, and it's not just at home, but it's also whatever facility individual is in.
Right. As a chaplain, we have 4 chaplains on our staff here locally, and then 1 in our expansion area in that 11 county area that we cover. And one of our chaplains actually services the center exclusively, and the other three of us here locally spend most of our time, in fact all of our time, going into people's homes and into nursing facilities
Okay.
and being the chaplain corps and the chaplain service for those people that request chaplain services.
That's good. Yeah, and that's good to know because some people may not request that service perfectly. They do, but with that service, also there's other services that they received. That is a little different than other organizations because I know we have other hospice organizations here, but this Hospice of Wichita Falls is a non-profit agency, so that entails more. I would say that entails a little bit more, not just service and things that you can do for individuals as well as other organizations, but as well as you have other types of governing bodies watching you and making sure everything is decent and in order.
Yeah, all hospices are overseen by governance of all kinds. The government's involved in just about anything they can be involved in. But what is unique, I think, about Hospice of Wichita Falls, in that we're a nonprofit, is that we get a tremendous amount of financial support from this community, which frees us up to do a couple of things. One, we never turn down a patient because they don't have funding, because they don't have Medicare or Medicaid or their own personal funds or private insurance. Nobody gets turned away. We have hospice care for all.
That's a blessing.
And we can do that because we have the support of this community, giving and giving and giving. And that allows us to do as much. I think the last statistic I saw was on average about $250,000 a year in services that we render to people who do not have funding. And that's money that has to come from this community, and we're blessed that they support us the way they do. But we get to do more than that. We get to provide accelerated chaplain and social services, services like extended bereavement care. Misconception I had: patient dies on hospice services, and that's it. They're done with hospice. No, they're not. Because at least for 12 months, we follow that family.
12 months.
And longer if they need and desire.
That's a blessing.
To give them the kind of support in their grief process. Because it takes time.
Yeah, and some people don't get that. I mean, it's sad to say, and it's not putting anyone down, because sometimes, you're dealing with yours and they dealing with theirs, and, you just can't come together to say, to help anyone. But it's good to know that hospice recognizes that individuals need that for lack of a better word, attention to be able to grieve as well as, come on, let's deal with life.
Right.
Let's get back to it.
And so we provide grief support services to allow them to do that with grief support groups that happen weekly and monthly.
Now, before we get into the various grief sessions and groups, it's not required though, right?
Oh no,
Okay.
no. All of this is, everything really.
I mean, I'm just
is
being
optional.
real. I would hope someone would take advantage
That's
of
right.
it. But some people are like, leave me alone.
Some people are leave me alone. Some people are fine.
Okay.
And some people have good support from their own local churches, and
Okay.
they don't need the additional support from hospice. But for those who do,
Okay.
it's there.
Okay. So what you said, the grief sessions or grief groups, but I know there's others in between there as well.
Well, there is grief support for the adults primarily in support groups, but we have some amazing children's programs that I've volunteered to be a part of. They don't pay me to do it. I volunteer to be a part of it because I've just seen kids' lives changed, and not just kids who have patients that have family members who've died on our services, but those grief support programs are open to anybody in the community.
Amen.
So we just finished Camp Grenigan, for instance.
So that's what it's called for the kids.
That we have up through I guess it's probably 6th grade.
Okay.
And we just finished it. First Assembly was very kind to give us their facility for the week, and 50 plus kids a part of this program.
Wow,
and
50 kids. That
came to
speaks
a
a
day
lot.
camp. They came to a day camp.
Wow.
Not all of them had family members die on our services. Some of these children had lost brothers and sisters in car accidents. Some of them were grieving the loss of a father or a mother who didn't die on our services, but were killed or died otherwise. But we treat them all the same. And they came to a day camp and they played and they had fun activities, but they also had grief support, special professional programs to help them work through their process using a lot of art and a lot of expression of their emotions. And I looked at some of the artwork that they produced from this week. They put it all up on the wall, and it was amazing where they expressed how they felt. And you
And
just
a lot of kids
stood
don't
there.
get to do that because the adults are so busy grieving with
That's right.
what's going on with them pertaining to the person that they have lost, where we kind of forget the children, and they have personalities, they have emotions, they have feelings that they need to have expressed as well, because they will act it out just like adults. I say act a monkey, kids will definitely act it out, and then we don't have that understanding of it's coming from and thinking, oh, they're just being unruly and bad kids. Well, no, they have some issues that need to be addressed concerning their emotions and what they have also lost. And I think it's good that you said how many children came, because a lot of people, I'm serious, a lot of people I don't think of that. A lot don't think of, but I want to say, as we get ready to go to break, and we'll come back and talk, of course, about more about hospice and the other groups, but I want to encourage those who, if you know of someone, or even if you have a child that has lost someone has gone on, someone has died, then I would encourage you to get with Hospice of Wichita Falls to have your child enrolled. Or if you know of a friend or some type of distant relative that you see some things you're like, you know what, they still need some help, I encourage you to get with Hospice of Wichita Falls and get them enrolled in the program so they can be helped as well as, they can be healed. We'll be right back with more Good Neighbors right after these messages.